Hello, sir. We are really very grateful to you that you done this surgery very well. But I want to ask you, apart from the fixation, what kind of surgery you do, and did you also deal with sclerosis surgery or brain tumor surgery? Can you please elaborate this?
Basically, I'm a neurosurgeon, as you know, so I deal with brain and spine both.
Okay.
In spine, we first what we did is from the basic surgery like microdiscectomies or endoscopic discectomies to basic fixations to minimal access surgeries to scoliosis to 360-degree fixation, which is like through chest or through abdomen anterior. We do almost everything. Along with that, the spinal tumors, all type of spinal tumors. Then in children, who are born with the meningomyelocele and lipomyelocele, the one which that also we operate a lot. A lot of pediatric surgeries we do, neurosurgeries. And we were talking about the scoliosis. We do regularly do scoliosis surgeries. All type of scoliosis almost we have done, and results have been from our side have been good. And along with that, in spine we do functional surgeries also in cases who have bladder bowel involvement, the ones who have urine problem, neurogenic bladder. In those cases we do sacral neuromodulation. And then in cases of the chronic pain syndromes, particularly the failed back syndromes, we do spinal cord stimulation also. In cases even the patients who have spinal injuries and are not able to walk, spinal cord stimulator has shown some good results. I would say promising results, which we have also tried, and we plan to do it more and see how good the results are ultimately. In brain, we do almost everything from brain tumors, from aneurysms, which we do surgically as well as endovascularly both. Functional surgeries like DBS, and then uh, normal trauma, which is there. Here also we do a lot of trauma, brain trauma surgeries, pediatric brain tumors, which are quite a number. We do a lot of them. Then shunts and almost I think everything, whatever is possible in the gambit, we do almost everything. We do in brain and spine both, and our results have been reasonably good, and we have found that a good number of patients are happy with us. So we hope that we are doing good work for them, and hopefully we'll keep on doing
Thank you
this.
for elaborating about your specialty. So the second very important question is that what kind of precautions the patient should get or should be aware after the fixation surgery, decompression surgery?
Like we have done in this
Yes,
case.
like we have done here.
See, basically, what is there is what is the problem basically in these cases is one is because of the nerve root compression. For some time, it may be a month or it may be a year, they are not actually fully functional and they are
Right.
not walking properly. Usually, they are taking more rest and other things. So, one thing what happens is that the muscles become weaker by the time they reach us. And secondly is that sometimes even the nerves are partially damaged also when they come to us. Sometimes they come early, sometimes they come late, depending upon whatever it is. So once we have done the surgery, the aim is to make him fully functional over next 3 to 4 months. So nobody can jump to the roof by just jumping it. So it has to be step by step. So what we ask them immediately after surgery is walk as much as possible, as much as they are comfortable, they should walk. So once they become more comfortable in walking, then we add some back exercises, which is to stretch the muscles also, and which is to strengthen the muscles also. So both. So muscles should be strengthened and stretched also, so that they become better. And as the wound heals, as the muscles heals after surgery, so they can keep on adding everything. To start with, usually what we say is that the things they should avoid is one is forward bending or lifting heavy weights or driving for long distances or sitting on the floor. these things should be avoided immediate after surgery. But once around in a month and month and a half, once they become more and more comfortable, they can keep on adding it. And expectedly that if they follow it properly, normally in 3 to 4 months they can do almost everything. Whatever, there's nothing which is prohibited after 3 to 4 months. They can play football also, but they have to do everything slowly and gradually. That is what is required.
Thank you so much.